Cardiopulmonary resuscitation or CPR. If you witness someone falling or you find someone lying on the floor, you may suspect that they have suffered cardiorespiratory arrest. Check the surrounding area and secure the area for you, the victim and third parties, so there is no risk of accident, power cables, water or liquids on the ground that touch the injured person, etc. Check that the patient is conscious, for which you should talk to them, touch them, pinch them, or even shout them to see if they respond. If unconscious, ask for help from someone nearby and call the university emergency telephone number at 916249999, indicating what has happened. Ask someone to get the nearest defibrillator and give your phone number just in case 112 has to call you. 9999 will manage all necessary coordination with security and emergency services. Another option is to call 112 directly. To check if the person breathes, we will perform the head tilt chin lift maneuver, which is the way to open his or her airway. To perform the maneuver, place the palm of one hand on the patient's forehand and push down gently in with the other hand. Lightly lift the chin farther up. We will try to open the patient's mouth to check if there is any object inside that could prevent an appropriate air intake. In this position, carry out the look, listen, feel technique. To do this, bring your head close to the patient's head. Look for movement of the upper or lower chest. Listen to the patient's exhaled air flow and feel exhaled air on your cheek. If the breathing is normal and we do not believe that the person has a spinal injury, the patient should be placed in a lateral safety position. If the breathing is not normal, place the victim face up, with arms and legs aligned, and provide cardiopulmonary resuscitation. To perform the CPR, use the head tilt chin lift method. Pinch the nose of the patient. Place your mouth tightly over the victim's mouth and give 2 full breaths of about 1 second in duration each, and ensure that the chest rises and the thorax falls between each breath. Then, check if the patient's heart is beating and try to find the carotid pulse. To do this, place your index finger and middle finger approximately 2 inches alongside the Adam's apple. If you do not feel the pulse within a maximum of 10 seconds, uncover the victim's chest and start doing 30 compressions. To do this, place one hand on the other with fingers interlaced and pulling them up. These compressions will be delivered in the center of the chest, in the middle of the lower third of the sternum, with arms extended and without bending elbows, so the entire weight of your body falls on the heel of the hand. Try to compress the victim's thorax between 5 and 6 centimeters. One trick. To know the appropriate rhythm of compression, count each compression as 1001, 1002, 1003 until you reach 1030. Perform cycles of 2 ventilations, followed by 30 chest compressions. It is better to ask for help as 2 people are needed for this procedure, so they can coordinate and alternate every 2 minutes or 4 cycles approximately, checking if the victim has regained a pulse and a spontaneous breathing. Repeat this procedure until someone arrives with a defibrillator or until the emergency services arrive. The university organizes courses on a regular basis on first aid. Sign up.